Hello, everyone, and thank you for joining. My name is Ken Harper, and I head up our Dragon product portfolio. I think all of us are really well versed in some of the challenges that are systemic in our healthcare system. But what we've seen over the last couple of years is AI is beginning to have a profound effect on both the patient as well as the clinician experience. Today, we're going to talk about the next step in this transformation with Microsoft Dragon Copilot and explain to you how you easily can migrate to this latest experience. First, let me highlight what is actually happening with some of these AI tools that are out there today. For the last decade with Dragon Medical One, we've seen 70% of all clinicians are using this tool throughout the course of their day to help improve their workflow. Over the last couple of years, we've seen the rise of ambient technology. This has been a game-changing experience where you walk in, you have a conversation with a patient, and your documentation gets prepared automatically. And we've seen in the last few years with ambient, 70% of clinicians that are eligible to use ambient adopt it highly within their workflow. What's really important, though, is we've seen that both these tools, historically front-end speech with Dragon Medical One, as well as Ambient with DAX Copilot, these tools continue to be used together interchangeably by clinicians. And so it's important as we look at what to do moving forward, how can we best accommodate both these tools being available, recognizing there are a lot of different patterns in how these tools are adopted from one clinician to the next. And that is why we have introduced in early spring our latest generation experience with Microsoft Dragon Copilot. This is bringing the very best of what you're using today with Dragon Medical One for front-end speech together with the very best of what you're using with the ambient experience from DAX Copilot, bringing those modalities together into one universal experience for clinicians. And we haven't stopped there. We've actually introduced a number of incremental capabilities with generative AI, where clinicians can now pick and choose the modality that they need to use based on where they are in their workflow. And this is available across the full care continuum, and ambulatory all the way to post-acute. We've designed Dragon Copilot to be available across all devices where you're performing care. And so why should you think about taking your existing experience from either Dragon Medical One or DAX Copilot and migrating to this latest experience with Dragon Copilot from Microsoft? There are three big reasons that I would highlight. The first being this is now the most comprehensive assistant that we've ever had. In addition to having front-end speech and the ambient capabilities with generative AI built in, there's now a full range of capabilities available, allowing you to do things like codify your documentation or speak with natural language to edit a note, or even create an after-visit summary with specific instructions that you ask it to put in the summary. This has also been designed out of the gate to have all of our future innovation built into it. We're announcing and coming out with an experience in Dragon Copilot for nurses as one example. We're also extending it with many more capabilities by having an open ecosystem. And we'll touch on some of those today. The third reason is we also have made this administratively easy for all of you to take this latest generation experience, deploy it within your organization, and have many benefits of how you administer the licenses and enable the use cases from one clinician to the next. For Dragon Medical One only customers, we also have a promotional offer. You can take all of your existing users that are using front-end speech today in Dragon Medical One, transition those to Dragon Copilot, where it's a like-for-like experience in those front-end speech capabilities. And in doing so, have a no-charge promotional offer where those clinicians for 120 days can also make use of ambient capabilities and other generative AI capabilities that are available in Microsoft Dragon Copilot. You then can decide after 120 days what you'd like to continue to make use of in addition to front-end speech. And to help you with the rollout and change management of Dragon Copilot, this promotional offer also includes professional services at no charge for up to 12 months. This is a phenomenal opportunity to get your organization on the latest, greatest experience and solution And then you have that deployed within your organization, and you can get access to our innovation that is available. I'm going to break down the different parts of Microsoft Dragon Copilot, starting first with the voice dictation experience, natural language voice dictation that's available. One thing that's incredibly important to highlight is we recognize that your organization, your clinicians have spent a tremendous amount of time over time customizing voice dictation to their workflow. That can include setting up auto text, creating step-by-step commands. Behind the scenes, we create speech profiles to make sure that each clinician gets the highest level of accuracy in their dictation experience. And all of that data and configuration that you have invested in Dragon Medical One automatically gets migrated into Dragon Copilot. And so this is something you can have peace of mind that when you go from taking an existing user on Dragon Medical One and putting them on Microsoft Dragon Copilot, that experience for dictation will continue to be that very best experience that clinicians rely on every single day. In addition to having that like-for-like experience, we've also added incremental capability for dictation. For the first time ever, you can create natural language memos for tasks or reminders that you want to make sure you follow up with in the patient record. You also, for the first time, have notes on the go. So if you're running from patient to patient, room to room with the Microsoft Dragon Copilot mobile application, you can actually get started on your note even if you're not working inside the electronic health records. We've taken what you're used to with dictation and we've added to it with Microsoft Dragon Copilot. The second part of Microsoft Dragon Copilot is the ambient documentation. This is where you can walk in, you can have a natural conversation with the patient, and your clinical note gets created automatically. Similar to front-end speech, we have built a lot into this experience where you can customize the output by specialty. We have style guides where you can set up the type of succinctness that you might want in your note, or the type of formatting you might want in your note. And we also have custom templates. We recognize that there's repeatable content that you want put into your note automatically. You can now do that with Microsoft Dragon Copilot so that the note that you're getting is customized to you and the area of specialty where you practice. And then the third part of Microsoft Dragon Copilot is all of the additional AI that we've put into this Copilot experience. And so you now have a chat interface where you can chat with the system, ask Copilot to do certain things on your behalf. This could be anything from codifying your documentation. If you want to add ICD-10 or CPT codes to your documentation, you could ask Copilot to do that. If you want to create a custom referral letter that just includes specifics of the patient encounter for the referring physician where you're sending the patient, there's now tremendous flexibility in what you can do with Dragon Copilot. And so the way to think about this is you're going from something that's trusted and a proven entity within your organization, whether that's Dragon Medical One and or DAX Copilot. You're transitioning your users to this latest generation experience where you're not losing any major functionality. All that speech data, again, is being migrated automatically with users, so their experience continues to be top-notch. And then you're complementing that with many more capabilities, your ambient experience, your generative AI use cases, all that becomes available. And not only for physicians, but Dragon Copilot is also now supporting use cases for nurses on the inpatient side of the hospital system. And so this is a very important aspect of what we're doing on Microsoft Dragon Copilot. Our focus has been on physicians. We're now moving into nurses, but we're not stopping there. Some of this very similar technology is going to be available to radiologists. We're also looking into the future on how we can support copilots specifically designed for other support staff in the organization. So let me double click quickly on what we're doing with nursing. Microsoft Dragon Copilot will support use cases specifically designed for med-surg nurses. The first use case is going in, having a conversation with a patient at the bedside. All those observational data elements that you're discussing get extracted, and we populate those directly inside of Epic, inside of your flow sheets. It's a documentation use case that's incredibly powerful, to streamline how nurses are doing their job. And we're also very quickly beyond just flow sheets, moving to other tasks with Copilot, where you're going to be able to ask questions and get information back about what you need to be taking in mind for the patient. Another aspect of innovation that's incredibly important with Microsoft Dragon Copilot is we have designed it out of the gate to be extensible. We announced recently that we're going to be opening up Dragon Copilot, where any third party that specializes in some capability that they're building can now plug that service or that capability inside of the Microsoft Dragon Copilot workflow. This is going to allow us to scale our innovation, whether it's revenue cycle management and you want to have prior authorization or more advanced coding as part of your workflow, or maybe it's the category of clinical decision support where you have vocal screening that's running as part of every Dragon Copilot encounter. We're opening this up to the ecosystem where third parties can plug in, and then you, the organization, can pick the applications, the plugins that you'd like to turn on that add most value to your organization. These are some of the partners that we're already working with to plug in to Dragon Copilot. Everything from companies working in revenue cycle management to clinical decision support. We anticipate hundreds of applications being available over time, but these are some of the initial companies that will be available when our storefront goes live early next year. Part of Dragon Copilot also includes a completely redesigned from the ground up administration center. We call this the Dragon Admin Center. This will allow you to have the flexibility on how you're managing your licenses from one clinician to the next, how you decide to administer features, what you want to turn on or off. You now have full flexibility and feature control by user or by department. And this also is where you can access all of your analytics so that you understand how this is being used inside of your organization. So this is a modern, scalable administrative center that we've now set up that is part of Dragon Copilot. As far as the migration, what's required of your organization, there are some technical steps that we take you through as well as some commercial steps. On the technical side, the requirements come down to two things primarily. The first is we do set up your organization with Entra ID. This is so that you have authentication in place for all of your clinicians that are accessing Dragon Copilot. And then we do have a new Dragon Copilot desktop experience that will replace Dragon Medical One or replace DAX Copilot on your desktop. And this gives you access to all those different modalities and use cases that we covered. On the commercial side, we have an approach, a very easy approach where we take your existing spend of Dragon Medical One or DAX Copilot. We have a way to convert that to some new flexible commercial models on the Microsoft side. It allows you to have way more flexibility in how you want to administer the software to each clinician based on some of the different usage patterns that we know exist from one clinician to the next. And as I mentioned, as part of the migration process, all of the investment your organization has made in setting up Dragon Medical One for success, your auto text, your step-by-step commands, the speech profiles, all of that data comes with you when you move to Dragon Copilot. We have an automatic migration process set up. And so the clinician experience when they go from Dragon Medical One to Dragon Copilot is preserved so that we make sure that we continue to deliver the very best experience to your clinicians. This is an incredibly important point to give you confidence that when you migrate, clinicians are going to be happy, and then they're going to be even happier when they get access to the incremental capabilities that are available. And then last, we do have new flexible commercial models with Microsoft Dragon Copilot. This is in recognition that there is a lot of variability when you go from one clinician to the next and how much they're using different features of the system. And so we have two models. The first model is a clinician can have an all-you-can-eat unlimited model. This is where unlimited use of front-end speech and all the generative and ambient capabilities. It's a per user per month fee, and it covers unlimited use for everything that clinician is doing. The second model that we have is a model where you have a set fee for your front-end speech. We recognize it's a tool that everyone needs to continue to have, but then you only pay transactionally for your ambient and generative AI use cases as clinicians use those features in their workflow. And so what's really powerful with these new commercial models is you now have the flexibility to look at your organization, look at some of the different usage profiles, and decide what clinicians belong in the unlimited model versus which ones are a better fit for the transactional model. And you can look at that every month and decide what position you want to put into what bucket. Okay, I'm now going to transition to Andrea Barrett, and she's going to do a live demonstration of Dragon Copilot so that you can take everything I just mentioned and actually see it in action. Thank you.
Hi, everyone. My name is Andrea Barrett. I am a healthcare consultant here at Microsoft. I used to be a physician assistant for about 25 years before I moved into technology. So I'm very excited to be here today to talk to you about Dragon Copilot. Now, my goal for the presentation is to show you how Dragon Copilot can be used by multiple members of the care team by taking you through a patient journey. Patient Randall Etheridge, who was admitted to the hospital. First, I'm going to show you how Dragon Copilot can be used by the prescribing clinician, so the physician or the advanced practice provider. And then we'll show you how a nurse can use Dragon Copilot at the bedside to complete their documentation. So let's go ahead and get started. So what you see here is the Dragon Copilot desktop. As a prescribing clinician, I can use the desktop to record. I can also use a mobile app, a web browser, and this technology is even embedded directly within Epic through the Haiku workflow. Now, I'm going to be a hospitalist for this presentation today. And as I log into Dragon Copilot, I'm going to go to these settings here, and under my profile, I'm going to select hospitalist. Now, we've spoken to thousands of customers. We understand that each clinician might want something different brought into their note. And for this reason, we have designed specialty-specific outputs that will be designated based on how the clinician logs in here. Now, I only need to do this once, and so I'm logged in here. In addition to this, if I wanted to do this encounter with Randall in Spanish, if I spoke Spanish and he spoke Spanish, we can do the encounter in Spanish, and the note is able to come out in English in the EHR, so I can go ahead and edit and sign it. So let's take you through Randall's story. So Randall is 67 years old. He essentially was admitted for pneumonia, mild sepsis, acute kidney injury. And I was able to get this very robust note just by doing a combination of single monologue, pre-charting through Dragon Copilot, as well as having a natural conversation with Randall at the bedside. Now, looking at this AI output, what's nice is that I'm able to apply stylistic preferences of my own, and I'm able to change these as needed. So one of the things I want to point out here is that I'm able to change any of these templates right here at my fingertips based on the type of patient I'm seeing at the moment. So let's say you're a family physician. You see patients all throughout different age groups and populations. And so you're able to change templates accordingly based on the type of patient that you're seeing. Same goes for a surgeon or a proceduralist. Now, I do want to talk a little bit about how we use Dragon Copilot to do really three things essentially. We use it to streamline documentation, surface information, and automate tasks. And that's how I want to take you through this presentation. So I've seen Randall, I've completed my note. I'm able to go ahead and further automate some tasks by looking at the orders. Now, these orders are essentially completed at the point of care at the time that my encounter is done. And it's able to listen to my conversation and extract that discrete data and pull this information for me to review. And looking at this, I said I wanted to, do all of these things on Randall, all of these different orders that I needed to place for him. And so imagine having to see 10, 15 admissions a day and having to place this many orders. I would be lying to you if I told you I never forgot to put in an order. What's more is that this technology is directly integrated within Epic workflow. Again, it's able to extract that discrete data and create appended order lists for the clinician to just review and sign. Now, let's go to the part of Dragon Copilot that I like the best. That's this ability to surface information. So if I've had a really busy day, even though these notes come back really quickly, I might have some questions about the patient. And rather than looking through the clinical summary to find the answer, I can simply ask Dragon Copilot. I can ask a question like, what was mentioned about the patient's support system? Now, what this is doing is it's accessing information from both this clinical summary that you see here, as well as the transcript. Now, the transcript is essentially the automated speech recognition, what I said, what the patient said, and it's able to reference it here. If I click on the transcript, it's able to bring me directly to it. And with this split screen view, I think that this is really nice way for, those clinicians who are new to ambient technology to be able to verify that AI output. They can just compare it directly with the note. Now, let's say I have a question about Randall's disease process. I'm able to also ask Dragon Copilot a question and get an answer from vetted medical resources. So maybe I have a question like, does ceftriaxone need renal dosing? Now, what this is doing is it's accessing information from 4 vetted resources today: the FDA, CDC, Medline Plus, and the MSD manual, which is the Merck manual. And so it's looking for information within those 4 sources to bring right to my fingertips so that I don't have to go to a different web page and review this. Here, what it's going to do is give me a summary, and it says here that ceftriaxone does not need renal dosing. It just gives me additional information. And what's nice is that it gives me where this information is coming from. It's coming from the FDA and it's coming from the CDC, and I'm able to go ahead and click on that information to read about it further. Now, in addition to being able to look for information from those 2 sources, we're also working on the ability for the healthcare organization to add on their procedures and protocols so that if I have additional questions, I can get all of the answers in one workspace. I don't have to go looking for them. So one of the things that's going to appeal to Dragon users is the ability to do natural language editing. And what's nice about this is that I can just look through this record and just make changes as I go along. So I think initially I said that he was 67 years old. I think he's 68. So let me just go ahead and start making some changes here. Change the patient's age to 68 years old. Add that the patient's daughter's name is Grace. And add that I want to hold off on nephrology consult at this time until I see further labs. Now, that was a very complex prompt. I did it as I was just reviewing that information, that output. But, Dragon Copilot is going to be able to execute on that command and update the changes appropriately. And you saw that I didn't have to dictate. I didn't have to add punctuation or anything like that. It's able to just make those changes very naturally. And so it looks like it's completed. I can go ahead and check my note. So it looks like it updated Randall's age to 68. It added that his daughter's name is Grace. And it added to my assessment and plan that I'm going to hold off on nephrology consult at this time. So it went ahead and just made those changes for me. And for you Dragon Medical One users, what you're really going to like is the ability to have a library in which you can save all of your prompts, your customizable templates. I talked about those earlier. Your texts, so those auto texts, those voice commands that you use today. Your workflows are your step-by-step commands, and that vocabulary. You have the ability to save all of this within this library. Now, one of the things I love about the library is that I'm able to do things like save prompts, and I have the ability with Dragon Copilot to create new content. So as a hospitalist, I have the ability to do things like create an after visit summary. I can create a referral letter. But what I like to be able to do is, create novel content. So what would happen with me is I would see the patient, I would admit them, but the patient's sick and they don't, remember a lot of times what you're talking about. And so I can just create something for when they're feeling better, they can read about why they're here. So I can say something like, create a patient-friendly handout as to why the patient is admitted and put it at a 5th grade reading level. So again, Dragon's able to take that information from the encounter that I created and reformat it and create novel content that I can give to the patient, Randall, when he's feeling better. He can read about it. He can give it to his daughter when she comes in to see him so that they're aware of what's going on, why they're here. And it just tells them that they're admitted for pneumonia, possible sepsis. He has some kidney problems, some hyponatremia, low sodium. And what's nice about this is that I can edit if I need to. I can print it out and copy it and print it out for the patient as well, which is really nice. Now, additionally, we get a lot of questions from customers about coding potential. And so what's nice in this library is that I've gone ahead and created different prompts and I can bring in coding if I wanted to. I can select here for coding on this HMP. And, what it's going to do is it's going to look at coding sources and go ahead and put information at my note at the bottom of it for the suggested E&M coding for this HMP. So it says here that the suggested CPT code is right here. And I went ahead and added that. And it just helps to streamline, when I go to sign this and code for it and bill for it, it just helps to streamline that workflow. Now, you had heard earlier, I talked about, being able to use this as a clinical documentation tool. But what's nice is that healthcare organizations can also use this as a platform. And we do that through the form of extensions. Now, extensions, here's the information assist that I showed you earlier. I can go ahead and choose this information if I want. But you also have the ability to add on different extensions such as up to date, maybe open evidence. You see that the Daily Med was added on here as well. But you can also use third parties to add on to here, such as, here we're using Canary. Now, Canary is a voice biomarker technology company, and it's able to screen patients for things like depression, anxiety, mild cognitive impairment, possible Alzheimer's disease. And it says here, they screen Randall, not a lot of anxiety, signs of depression, but he's sick. He's admitted to the hospital. It's just something I need to follow up on. Maybe I need to do a PHQ-9 on him. Maybe I need to just watch him really further during this hospital stay and talk to his PCP. But you're potentially giving that patient an earlier diagnosis, potentially a better outcome using this. And it's all within one platform. I don't have to use 5 different applications for this. And the health system doesn't have to have a heavy IT lift to be able to run this. So it's really convenient in that way. Okay, so let's continue on with Randall's story. Let's say Randall made it up to the floor and I'm now in the persona of the nurse taking care of him. Now, as you all know, nursing has a much different documentation workflow than a physician has. Their documentation tends to be in very click-heavy flow sheets. With Dragon Copilot for the nursing persona, it's able to allow the nurse to have a natural conversation at the bedside with the patient, and that information is able to be extracted and placed into discrete data fields into the flow sheet. Now, today, this is being used through Epic's Rover technology, but what I'm showing you during this presentation is a standalone application. So as a nurse, I would very easily just be able to walk into Randall's room and say, hi, Mr. Etheridge, I'm Andrea. I'm going to be your nurse today. Or I heard you were admitted for pneumonia. Tell me how you're feeling. What's your pain scale at? How are you eating, etc. And it's able to take all of that information and again, extract that discrete data and place it into the flow sheet accordingly based on the organization's schema. And so you can see here, it was able to get all of this information. He had some nausea, his family was coming in. This was an admission assessment. And what's nice about all of this is that I can review this information directly within the mobile application. Nurses will also be able to review it directly within Hyperspace and make any corrections needed before it's available to the care team. Now, we've spoken to a lot of nurses during our private preview process, and one of the feedback that we heard is that they like to be able to see a guide to see what kind of information needs to be talked about during in a flow sheet. And so it really just gives them a guide to talk about things that need to be covered during certain encounters. This guide is going to be updated in real time for the nurse so that they know what they talked about with the patient. Additionally, they have the ability to look at a transcript for the patient as well. and be able to get that information. If they have questions about it, it's able to take them to a specific area so that they know what was referenced at what time, etc. What's nice about this is that this is currently available today, but we are continually working to improve this product. And just like you saw with the prescribing clinician workflow, nurses will also have the ability to do things such as summarize the interaction. They can create a narrative note from the encounter. They would be able to create an incident note if that's what happened. And they would also be able to get answers from vetted resources, including the organization. So let's say I had a question. They thought they had drawn Randall's blood cultures in the ER, but it turns out that one of them was not able to be processed. So I have to draw some blood cultures from his peripheral IV. But I might have a question about that. So maybe I have a question about how to draw that. So I can just very easily ask Dragon Copilot, what is the correct procedure for collecting blood cultures from a peripheral site? Now, what this is doing from a nursing persona perspective is that it's accessing information from the organization's approved nursing policies and protocols, and it's able to bring this information to me, directly within the application so that I don't have to search for this information online. And so here, it's telling me how to do this. It's telling me, that I need to explain to the patient, hand hygiene, site preparation, all of these things. But what's nice is that I can see that this is coming from our nursing policy, blood cultures collection policy. And so I know where this information is coming from. I know that this is what I'm supposed to do, and I'm going to be in line with our organizational goals. So thank you for allowing me to walk you through our Dragon Copilot for the nursing experience. Before we finish, I just have a few more things I want to talk to you about. The first is our Dragon Admin Center. Now, for those of you who are already familiar with Microsoft and administrative management centers, we've created one specifically for Dragon Copilot. And this allows you to manage things such as licenses, provisioning, group hierarchy, feature management, and it's really easy, intuitive to use, and it can be scaled easily across your organization. Now, in addition to that, it can provide a wide range of analytics. For example, what you're seeing here is analytics on user adoption and usage here. Lastly, Dragon Copilot integrates with Microsoft Fabric, our data platform. By combining Dragon Copilot's conversational records with other patient data, organizations can use AI for tasks like finding patterns in clinical data, reaching out to patients, improving healthcare management, and much, much more. And with that, I hope we piqued your interest, and I want to thank you for your time. Have a great day.